Thank you all so much for having me today. My name is Mike Neafsey. I'm the One Health Coordinator for APHIS Veterinary Services. Have the honor of joining some of my colleagues here in the audience. So I have Dr. Sierra Burrell, who is our liaison to the CDC, and Dr. Steve Burkant, who is our public health veterinarian for Office of Interagency Coordination. So today's discussion is the federal strategy for animal surveillance, information sharing, and the dissemination of guidance. So preparedness and response planning for foreign animal disease incidents such as JEV is really crucial for USDA, states, and industry, as well as other stakeholders to all come together to protect public health, animal health, the environment, and the economy. So, that one worked. So the likelihood of JEV being introduced to the US may be small, but it's one that APHIS Veterinary Services takes very seriously. And we can look at other mosquito-borne flaviviruses such as West Nile virus to see how a virus can go from just being introduced to being well established across the US. And if it's established, as we've seen with West Nile virus, eradication is very difficult to almost impossible. If JEV were to be introduced, it would become a very important human and animal health problem, as well as it would have substantial economic impacts. The introduction of West Nile virus into North America overcame several unfavorable circumstances, such as complex ecological and geographical challenges. JEV currently, faces these same challenges. However, there are a couple, factors that aren't in our favor right now, and those really are climate change and widening or the expanding of mosquito distributions around the United States. So introduction of JEV into the US could happen through infected mosquitoes, infected vertebrates such as birds, pigs, or humans. But because of animal quarantine procedures, migratory bird flyways, short or low-level viremias in most vertebrates, most likely mechanism, as we've heard in talks this morning, most likely mechanism of introduction is through those infected mosquitoes. So if JEV were to be introduced into the United States, recognition may be delayed on the livestock production side. And that's because of the disease's non-specific presentation. In the literature, we're hearing, it could impact 1% all the way up to 70%. And so if it happens to be on the 70% side, obviously we're going to see this right away and be able to act on it. But if it happens to fall in one of those lower percentages where, abortions or other, non-specific signs could be missed to other diseases, it could present an opportunity for delay. There's also limited research around competent vectors here in the US, and it would share a regional mosquito vector for West Nile virus and St. Louis encephalitis viruses. Before I get too far into discussion today, I figured I'd set some objectives. So we want to discuss APHIS's current activities, collaboration, and information sharing, discuss APHIS's authorities to conduct investigations, discuss clinical presentation and APHIS's initial response strategies to foreign animal disease investigations, discuss diagnostic capabilities and capacities, and discuss challenges and knowledge gaps. So APHIS Veterinary Services, if you are, APHIS in general, I'll start there. It's made up of 6 programs, 5 management-wide support units, 1 office that supports government-wide initiatives. We have over 8,000 employees stationed in all 50 states, 4 territories, and 35 countries around the globe. There are 6 operational units, but today I'm only going to really cover 4 of those 6. The units that I'll cover today: veterinary services, animal care, wildlife services, and international services. The bulk of my conversation today will really be around veterinary services and our response, but I'll touch on animal care, wildlife services, and international services, because each program really could have a unique way to interact with our stakeholders, whether it be through disease surveillance, vector control, or just providing general information to our stakeholders. So veterinary services at the top here is organized into strategically focused business units. So we have field operations, strategy and policy, and diagnostics and biologics. The VS staff works with the state animal health officials and the state public health veterinarians. I'm going to go ahead and apologize in advance if I happen to slip and use an acronym. You're going to hear SAHOs, state animal health officials, or SPHVs. That's our state public health veterinarians. I'm going to try my best to say the full phrase for everybody there, but if I happen to slip, that's what that means. So we generally work with the SAHOs or state animal health officials and the state public health veterinarians on emerging One Health issues around the country. So our field operations and our commodity staffs regularly conduct exercises with the states to prepare for emergencies and to help to identify gaps and identify ways to collaborate and communicate more efficiently and effectively. Animal care, they work with our regulated zoos. So they enforce the Animal Welfare Act, they work with zoos, and they work with biomedical research facilities, both of which could contain species that may be susceptible to JV. You know, this is one of those gaps where we don't know exactly which species they have and which species may be susceptible to JV. And so they're going to be an important stakeholder to use that well-established relationship to communicate about JV risk and, you know, any surveillance that may need to happen there. International services, they work with international partners to prevent the spread and reduce impacts of emerging diseases like JEV. Wildlife services, they respond to reports of wildlife illness or die-offs. And I'll cover a couple of the wildlife services activities because I feel like feral swine is really a big, you know, puzzle piece to this particular discussion here. And then I'll circle back again. I'll share the bulk of my presentation will be discussing VS work on commercial swine. So this is a cluster map depicting feral swine sampling efforts across the US. We're also working extensively with US territories of Puerto Rico, US Virgin Islands, Guam, but they're not depicted on this particular map. But we had some discussion earlier about some of those activities. The National Feral Swine Program removes feral swine from approximately 30 states and 3 territories and conducts disease surveillance from a subset of those animals, so about 6,000 animals. And what they're looking for, specifically swine brucellosis, pseudorabies, and classical swine fever. Wildlife Services also maintains an archive of serum samples, and that represents thousands of individuals from across the country to be utilized to answer questions about, you know, retrospective disease exposures. In addition, you know, Wildlife Services conducts morbidity and mortality surveillance where, you know, wildlife biologists are out there looking for sick or dead feral swine, as well as conducting observational surveillance for, you know, vesicular lesions, looking for things like African swine fever or foot and mouth disease. So VS and Wildlife Services have worked really in close partnership to develop a triage protocol within their framework for an early detection event for any foreign animal disease that may come in through a wildlife animal here. So the existing archive and surveillance structure really could be readily exploited. So we could screen historical samples for evidence of exposure or, you know, develop an active surveillance stream. So Wildlife Services stands ready to support APHIS, states, and industry for detecting and controlling JEV if necessary. So veterinary services field operations. So this is our largest group within veterinary services. When it comes to initial disease response, we typically will lean on field operations, and that is because they have the pre-established relationships with, you know, the commercial veterinarians. They've got established relationships with, you know, just the general community, local producers, supporting animal industries. They are there on the ground, in the field, at the local level. So if human cases were reported by CDC, so partners at CDC let us know that they found a case of JEV. What we're going to do is we're immediately going to communicate that down to our field staff, particularly in the state that, you know, the human case was identified. And that individual is then going to go to the state animal health official. They're going to go to the public health veterinarians. They're going to go to our partners at the local level and start communicating surveillance activities, surge capacities for laboratories, staffing resources available to support any initiatives, other critical functions that we may need to support along the way. Early communication, whether it be a foreign animal disease or, you know, in context of where we're at right now, JEV, you know, early communications really likely would focus around ramping up common biosecurity practices. And that would include management practices such as eliminating standing water, which would, you know, ultimately decrease or eliminate a potential vector. Veterinary services, diagnostics, and biologics. So diagnostics and biologics is home to the extremely hardworking staff at the National Veterinary Services Laboratory, or you'll hear me reference them as NVSL. They have 2 locations, one in Ames, Iowa, and one in Plum Island, New York. Strategy and policy. This is our last of the veterinary services units. Strategy and policy houses the commodity staffs for each commodity type. So we support everything from aquaculture to poultry, swine. We have the ruminant health centers. These folks have relationships built and exercised every day with industry at the national, regional, and local levels. So I know that I've highlighted a little bit of our animal work, talking about field operations and what they do, and commodity staffs and what they do in these regularly exercised pieces here. But the Office of Interagency Coordination, what we do, my office, we house the liaison to the CDC, and she provides a daily briefing to us of One Health issues such as JEV. So if an emerging issue were to pop up, Dr. Burrell, who's in the audience, would be sitting down with our colleagues over at CDC almost immediately, and would be relaying that back to us so that we could communicate any strategies along the way to our leadership, so that a response could be quickly formulated and then re-communicated out to our field members. We also, strategy and policy also houses the Food Safety Inspection Service and FDA liaisons, which help to communicate issues that are being seen over at slaughter and processing facilities. Those folks are extremely important because they help us to talk about pre-harvest interventions that may be needed. I know this may not be completely relevant to JEV specifically, but other foreign animal diseases that require a pre-harvest intervention prior to slaughter and processing. These liaisons would be absolutely crucial to making sure that message is communicated, what is being seen in the plants, so that we can communicate that at the local level. Lastly, our NOLN program, or that's another critical piece of strategy and policy. And with JEV in particular, swine producers and their veterinarians very likely would be submitting samples from clinically ill animals, or maybe submitting aborted or mummified fetuses. So these samples would go to the local NOLN laboratories. Just for everybody's reference, the NOLN is a partnership of federal, state, and academic research or laboratories, about 60 laboratories nationwide, and they're capable of testing very large numbers of disease-specific agents from livestock, again, across the country. So what we would be doing in this circumstance, we would immediately take the information that we learned either at the local level from the livestock producer or from partners over at CDC, and we would then be communicating down to the local laboratory levels as well. We would ask about what are their testing capabilities, what are the surge capacities, what staff do you have, and how can we best support that particular program. So authorities, the Animal Health Protection Act, it authorizes the Secretary of Agriculture to prevent, detect, control, and eradicate diseases and pests of animals, which includes foreign animal diseases and emerging diseases. And that's to protect animal health, the health and welfare of people, economic interests of livestock and related industries, the environment, and interstate and foreign commerce of animals. The Code of Federal Regulations, or the CFR, provides regulations for the delegations of authority under the Secretary of Agriculture, the Undersecretary of Agriculture, and the APHIS Administrator. Homeland Security Presidential Directive Number 9, it establishes a national policy to defend agriculture and food systems against terrorist attacks, major disasters, other emergencies. And that really, this particular one puts us in collaboration with HHS and DHS to work on the veterinary stockpile as well. The Agricultural Bioterrorism Protection Act of 2002 mandates that we will prepare for, respond and respond to bioterrorism and other public health emergencies. And this one has some language in there around select agents. And so I guess I should put it out there for everybody that JEV at this point is not a select agent. So what we may see, we know that JEV is a mosquito-borne zoonotic that causes encephalitis in people, but the mortality rate in piglets may be near 100%. As we talked about with our Australian colleagues this morning, it doesn't follow the book. So I can pull numbers and I'll have some in a minute that come directly from literature, but what we've seen in real life may not reflect some of that. So please exercise some caution when I say the numbers, because there is a very wide range in a lot of this. Mortality rates of near 100%, mortality in adults being close to zero, reproductive losses. We've seen figures that say 1%, and then the literature will go all the way out to 70%. So that is a really wide range here, and we really hope that if we happen to deal with JEV here in the United States, that our numbers would be very much on the lower side of things. So if JEV was introduced to a region with domestic swine operations, abortions may be one of the only things that we see. And if the number of abortions or mummified fetuses is low enough to where it may kind of mold into normal losses, that may actually not trigger foreign animal disease investigations. It may put us in a spot where we don't immediately think this is JEV. It could be one of the many other reproductive issues that swine could have. So because there is specific testing that's required for JEV, there would be a low likelihood of diagnosis immediately if JEV hadn't been considered in the US before. Now, that's speaking with the caveat, the asterisk here, that if we have something like what Australia presented this morning, where we have large numbers of mummified fetuses, those things would be triggers. The swine veterinarians would be contacting their local laboratories. They would be having these discussions very quickly. But if it happens to fall on that 1% number, which the literature had discussed, we may not see it. So that's where I'm saying that it may not be immediately considered as the primary here, unless there was a reason to consider it. So most pig production is in areas that are likely low risk for introduction, and that's because, again, as we discussed with our modeling, they aren't necessarily near major ports that service Asia. Again, therefore, it's unlikely that routine pig surveillance would be sensitive or timely enough to detect JEV introduction unless there was another factor here that we were looking at. So pigs being the main amplifying host of JEV, horses and humans can become ill. So as we discuss, again, a lot of other species are dead end hosts here, humans and horses being some of that. So for equine patients, we have inapparent or subclinical infections would likely be the most common. And what we may see in horses would be, it would be the nothing that's going to point specifically to JEV. It's going to be very similar to what we'd see with West Nile virus. It would be, Eastern equine encephalitis. Those same things are going to be shared across. So different arboviruses are going to all share the same kind of presentation. So again, unless there is a trigger that says, we have this really unusual finding, we have horses and pigs in the same geographical region that are becoming sick, or we have a human case, it may not be the first thing that we point to. However, all of that being said, I do want to highlight something that our equine staff in strategy and policy has in place, and that's the arbovirus response framework. And it's used for Eastern equine encephalitis and West Nile virus. And it's used to basically screen neurologic diseases of horses. And I realize that equids aren't the focus of this discussion, but the framework that they have developed could be expanded, if JEV were to really become an issue here in the United States. Again, our findings of abortions or abortions, stillbirths in swine, as well as neurologic horses, really could up the discussion quickly around JEV. If we're finding both in the same geographical region, it's going to be important for veterinary services in particular to have these well-established communications with industry, being able to talk across commodities to identify these issues quickly and find the right path forward with testing. So as I mentioned before, initial samples would likely go to the NALM labs. So these labs would rule out other foreign animal diseases. The NALM lab has trained and proficiency tested analysts that are ready to participate in foreign animal disease investigations, or provide surge capacities as needed. And non-negative samples would then go from the known labs to NBSL for confirmatory testing. So NBSL, they maintain virus isolation and molecular tools, including sequencing for detection and differentiation of flaviviruses, including JDV. So they'd use whole genome sequencing to differentiate a lot of the flaviviruses from one another. Detection of antibodies is also possible using the immunofluorescent assays. If high testing numbers were needed, very likely what would happen is we would really lean on our local known labs to make sure that they have the surge capacities, they've got the testing needed, and then we would really lean on the confirmatory testing being the thing that's at NBSL. So as I mentioned, just a second ago, samples are going to go to the known laboratories. This is a map of our known laboratories. Some of the known laboratories do have species-specific expertise, and we would help to support those laboratories as any incident were to start to ramp up. I do want to highlight here, as you see at the top of the screen, the known laboratory network is celebrating 20 years of working to support American agriculture. So this is where I'm going to start a little bit on some of our existing frameworks here. So APHIS does have pre-existing frameworks that support many different disease responses. One that I'll highlight is the foreign animal disease investigation framework. I do want to stress that that at this time, our leadership is not yet committed that our response is going to follow any one of these specific frameworks. We're still in the mode of gathering information, talking to stakeholders, but we do have basic elements of any response strategy, such as communication with states, industry, and public health partners that are going to sit at the foundation of any response. So, we'll be here. We'll continue to work with partners to learn about this emerging issues and try to determine a best path forward. So again, foreign animal disease investigation framework is one of our pre-existing frameworks. We've used it to successfully detect, control, and contain diseases of animals for many, many years. Within this, APHIS coordinates with federal, state, tribal, and local partners, as well as animal industries, to coordinate response, manage public messaging, take control measures to eradicate any disease that happens to cross into the United States. So a couple things that veterinary services in particular provides. We provide on-scene support response capabilities in collaboration with state, tribal, and industry partners. In close collaboration with the SAHOs, the state animal health officials, VS will assign the foreign animal disease diagnostician to investigate possible cases of foreign animal disease or emerging disease issues. Veterinary Services also operates the NVSL, or National Veterinary Services Laboratories, and that is a reference laboratory for many of the foreign animal diseases. After diagnosis of an FAD, or a foreign animal disease, we would circulate warning messages to federal, state, and industry partners to really facilitate more timely communication and response. And after an incursion has happened of a foreign animal disease, we work to identify mitigation strategies. And we specifically work with our partners over at CDC to talk about the zoonotic potential, and we regularly coordinate with them on any zoonotic disease issue. VS and wildlife services, also work together to prevent the transmission of diseases from wildlife to domestic animals and from domestic animals to wildlife. And we've got a center that is within strategy and policy that would conduct pathway analysis and risk assessments that would focus on predicting likelihood of movement of diseases to new locations. All right, this is a little outdated, but I'll try to fill in some gaps here. So in the past 20 years, we've had over 19,000 investigations of possible foreign animal diseases in the US. So this graph is a summary that's compiled from animal health reports that's published by Veterinary Services using EMERS data. EMERS is the Emergency Management Response System, which is the system of record for foreign animal disease incidents. So in 2020, we see that there were 2,718 investigations. 83% of the total number of investigations were vesicular complaints here. In 2021, which I realize is not represented here in the graph, so I apologize for that. We had 2,112 total foreign animal disease investigations. 1,536 of those were in swine. 1,483 or 96% were vesicular in nature. 1.7% of those were due to high death rate or sick swine, which is how we probably would see JEV present here. So APHIS has a document called the Foreign Animal Disease Preparedness and Response Plans, or FADPRep, and we've seen a couple little snippets make it into slides from this morning. And that provides an overview of our framework for incident management, funding, communication strategies, relationships, and authorities during an FAD or any other outbreaks. In addition to FADPRep documents, there are industry manuals that are posted online that help describe the complexity of the animal industries, and they really help responders and provide industry information about emergency preparedness and response, and that helps not only responders, but it helps to communicate with producers as well. There are a number of SOPs that are also in this particular package, and they are all found on the FADPRep website, and they contain details for conducting critical activities such as communication and what we do around biosecurity, and they're essential for preparedness and response to any foreign animal disease outbreak. These SOPs are a little bit more detailed. They provide the operational details that aren't necessarily discussed in any strategy or a disease-specific response plan. So the SOPs are kind of the rubber meets the road kind of document. It's really the operational side. I'll note, and I've seen it posted up in some of the other presentations from this morning, we do have a JEV disease response strategy. It's currently under review and has been removed from our website. The material that was online was removed. It was a response. It was not a response plan. It was just a set of strategies to support any response. That information was outdated and in no way would reflect how APHIS would respond to JEV today. So just for anybody who may have that still saved on their computer, may still be using that information, we have pulled it from online, and it does not reflect what APHIS would be doing today. Oops, let's see. There we go. So going back to foreign animal disease investigations a little bit, achieving these goals allows livestock and poultry facilities, states, tribes, all to resume normal production as quickly as possible. So that's definitely one of our goals when we're dealing with foreign animal disease incursions. These goals allow the United States to regain a foreign animal disease free status. We always want to keep that free status. And we also want to keep in mind that any response that we do, we don't want to do more damage than the disease itself. So some of our goals, we want to detect, control, and contain foreign animal disease outbreaks as quickly as possible. We want to eradicate them using strategies that stabilize American agriculture, the food supply, the economy, while protecting public health and the environment. So again, taking very much of a One Health approach here. We want to provide science and risk-based approaches and systems to facilitate continuity of business for non-infected animals and non-contaminated animal products. So last two response goals here, we want to identify all contact premises within 24 hours. And within 96 hours of finding any index case of a foreign animal disease, we want to identify the risk factors and develop mitigation strategies. So we've got several challenges that go along with any foreign animal disease response. So we have significant disruption to interstate commerce and international trade. Response activities are complex and require significant planning. And as everybody has been involved in, if you're with the swine industry or with the state, there's a lot of preparation that goes into being ready for these incidents. Outbreaks also, as we've seen, with West Nile virus, they are rapidly changing and become large and widespread. That has been highlighted this morning as well. A couple more potential challenges to foreign animal disease response. We've got large, diverse, geographically spread teams. They need to be able to be assembled quickly, and they need to be able to be rapidly deployed. not all of these emergency responders, not all of our staff, not all of the state folks that are going to be helping us here have prior livestock experience. We may be pulling from program managers, we may be pulling from administrative staff, but we need to be able to communicate to them exactly what their goal is, how they're going to achieve their job. Another one of the challenges, complex veterinary activities and countermeasures, take significant preparation. And again, preparation means time, money, staffing to be able to do those types of things. So we need to be able to, spend time with all of you to be able to talk about emerging issues, what it's going to take to mitigate these things. Now, I know that I mentioned complex veterinary activities, and that might not necessarily fall into what we're doing right now, but this is kind of step one to being prepared for that type of thing. Last challenge is we need to be able to rapidly scale up, train personnel. We need to be able to work on the fly. And if resources become scarce, we need to have a strategy for being able to prioritize things and be able to work across the United States as an issue becomes, widely geographically spread or resources become scarce. So apologize. So I didn't do it.
You're done.
They've cut me off. All right.
You should still have access. Can you just reshare?
Slide back into screen share.
Yep.
That's the cue to exit stage left.
Here, correct?
No, it's a little bit further down. We are, excuse me. No worries. Sorry, I'll get it right back up in just a second. Lessons learned. All right, let's see if the ghost of the computer doesn't come back on me here.
Mike, can you take the top off?
Oh, yes.
That's fine. We're good.
And then hide floating controls. Okay, this is a little better for everybody. All right, so the last couple of years, we've had some challenges with SARS-CoV-2 and avian influenza, but those particular responses have really helped to hone in on skills and build relationships that are going to be needed for any foreign animal disease response. So including sitting at the table talking about JEV. So we want to provide processes for plannings, and we want to make sure that we respect local knowledge. That's a critical part of any planning here. We want to integrate state, federal, tribal, and industry planning processes. We realize that any planning doesn't happen in a vacuum here. We want to make sure that we're taking the response plans from our public health sector. We want to take the ideas that are coming from the swine industry and to be able to have discussions and take all of that into account when we're making our own plans. We want to ensure that there are clearly defined, attainable, unified goals for any response. And we want to make sure we have a unified command with proper delegation of authority that's able to act with speed and certainty. There we go. All right. We want to make sure that we are employing science or risk-based management approaches to any FAD response. We want to ensure that all guidelines, strategies, and procedures are clearly and effectively communicated to responders and stakeholders. We want to identify resources and train personnel required for any response. And we want to achieve rapid foreign animal disease detection and tracing. So when it comes to JEV and really any potential foreign animal disease response, there are a few gaps that we need to address before a protocol can be deployed effectively. And we need to further characterize the competence of potential vectors and ability of local vertebrates to act as amplifying hosts. Again, that's going back to working with, let's say, APHIS Animal Care, and they have very unique stakeholders that fall into zoos. Some of those animals, we don't know if they're vectors. Even going into our wildlife services partners, some of those wildlife vectors, we're unsure. We don't know exactly, which migratory birds are likely to, be infected, which are important, which may be true dead-end hosts that really, aren't necessarily part of the cycle, but just an incidental finding of sorts. We want to determine the cross-reactivity of Japanese encephalitis virus, West Nile virus, and St. Louis encephalitis virus to better understand the likelihood of animals with JEV being incorrectly diagnosed as having one of the other local findings of, again, West Nile virus and St. Louis. We want to look at the cross-protective characteristics of flaviviruses and effective vaccines. At this point, we need to look, West Nile virus vaccine, what cross-protective characteristics does it have for JEV? Pig-to-pig transmission, that was another one that was mentioned earlier. And as of right now, its role in natural transmission is really unclear. And then lastly, additional mosquito surveillance activities in higher risk areas. And that's really to increase the probability of detection of any introduction. So in closing, in response to a foreign animal disease introduction, APHIS capitalizes on pre-existing relationships with state, federal, and industry partners. And again, these have been tested through SARS-CoV-2, through avian influenza, and other disease incursions, foreign animal disease responses. Every response is going to happen at the local level. It starts and ends at the local level. Our field operations staffs have those relationships built at the local level. We have folks that are talking to local producers, local veterinarians, the state animal health officials, state public health veterinarians. And we're going to use those those networks to really gather and share information across with the states, with industry, with any other stakeholder partners. As with any outbreak, the first thing that we're going to share is, what cases have been identified and how future cases can be prevented. The type of information, we commonly talk about biosecurity practices. We talk about, animal movements. We talk about, the disease ecology itself. Regardless of what APHIS decides to do as far as our response strategy going forward, I can't see that we're going to deviate far from those traditional values that we've held with any disease response. Communication is always going to stand at the forefront. And again, response is always going to start and end at the local level. So I'll open it up to questions.
What questions do you have from the audience, please? Paul?
So Paul Sundberg, Swine Health Information Center. Mike, thanks for all of that. That's a great outline of the goals. And I have a couple of specific questions. One, with the diagnostics in the non-laboratory system, do you know if they are capable of having a non-negative test in a non-lab now? Do they have PCRs for JEV that they can use, or do those samples just automatically get cycled to Plum or NVSL? That's first question.
I believe the samples right now would be cycled over to NVSL for confirmation, and they would use the whole genome sequencing to differentiate the flaviviruses. And again, they do have the immunofluorescence assay to look for antibodies, but they really would lean on the sequencing as far as
that's what I expected. Second question is kind of a historical one, because you reference foreign animal diseases all the time in responses and in planning, et cetera. Another term, though, that we've heard in the industry, that we've heard APHIS use, is transboundary disease. Can you help with the different definitions of those two? Foreign animal diseases are all transboundary diseases, but are all transboundary diseases foreign animal diseases?
That's a really good question. And to be honest with you, I'm going to have to get back with you on that.
Yeah. Okay.
I'd hate to put my foot in my mouth and give you an incorrect answer here. So I'll circle back with we have a transboundary team, and I will circle back with them and be able to get you the answer to that.
Okay.
There was another question.
Thank you, Dr. Neafsey, for your presentation, also for the clarification about that document that I presented and the fact that it's not available anymore. So speaking about that, could you elaborate as to, if you're aware, what are the main changes that are being captured in that document? And you said that there are ongoing efforts into reporting what the preparedness plan will be for JEV.
Okay. So right now, I mean, we're taking part in activities much like this to sit down and talk with stakeholders about the importance of this emerging issue. We're still in information collection, and we'll take this information back to our leadership to be able to communicate the the urgency and what we're learning here, and be able to incorporate all of that into the document moving forward. But as far as right now, I don't have the specifics of what is contained within the document and the future of that document. But again, we're going to take the information that we're learning and we're discussing here today, take that back to leadership to be able to bring forward for whatever strategy or policy is recommended.
May I ask another question?
Absolutely.
Can you also, you mentioned as part of surveillance efforts that USDA is putting forward, you mentioned feral pigs and zero prevalence surveys of feral pigs. Are there any other efforts or ongoing efforts to put forward mosquito surveillance or sentinels for surveillance of specifically for JEV that are in the works?
That's another good question. I think we've really leaned on our state and public health counterparts for mosquito control and surveillance activities. I will have to get back with you if there are any specific activities related to mosquito control that APHIS is a part of. Again, I'd hate to say yes or definitely no, but I'm unaware of any specifically. I know that we have, in collaboration with state and public health, supported those activities, but where we are leading them, I'm not sure at this time.
Thank you for that presentation. This is Megan Niederorder from the Swine Health Information Center. I was curious, one of the figures you'd shown that's fairly staggering is the number of foreign animal disease investigations, and that there's only a very small percentage that's due to high death loss. I think you said 1.5%.
7%.
1.7. So then you go, okay, likely a high death, there likely is high death loss that is not having a foreign animal disease investigation. And I'm curious on your opinion on efforts to either increase foreign animal disease investigations and sort of what you're doing in that area, or also on the opposite side of that, should we be looking more at syndromic surveillance, such as if the VDLs are receiving more reproductive losses, abortions, mummified fetuses, should there be some trigger with that for JEV surveillance, as opposed to relying on foreign animal disease investigations to identify a potential outbreak?
Understood. So the second part of that question, should we, I think it's always a good thing to increase communication, especially, with our producers, with their veterinarians, with our laboratories, to talk about findings, especially around high death loss, especially, if there are human cases of JEV, or we happen to find it in feral swine, then, alerting the network, having more frequent communications around these issues is absolutely going to be a critical part of moving forward here. As far as, connecting JEV and surveillance, death loss, and having more foreign animal disease investigations, this is where accreditation training comes in. We're leaning a lot on our accredited producers, our accredited veterinarians, and our local field staff to, again, talk to the producers, talk to the state animal health officials. What trends are out there? What are they seeing in their local area? If it's starting to rise to the point where there really is something that's unusual here and we can't find at the local lab or the industry lab, we can't find exactly what's going on here, that's where, again, increasing communications, using those pre-established networks is going to be critical to move forward. That will help to quicken the pace of being able to identify those trends or, unusual findings.
Just to comment on that too, I think that one of the challenges of ASF surveillance is that, on the opposite side, is that there's all these different clinical signs that ASF can present as. So we really need this robust surveillance. JEV, on the other hand, has a fairly specific clinical presentation with regards to what we've seen in Australia. So there could be, in my mind, maybe an advantage that we could take, or an opportunity that we could look at with JEV going, if there's increased in mummies or increased stillborn, this is where you really perform some targeted surveillance.
No, I understand. There are a number of challenges when we're referencing ASF versus JEV. I mean, the mosquito-borne aspect, the zoonotic aspect, all of the other potential wildlife reservoirs that we may or may not have. all of the unknowns with JV here in the United States right now makes some of this very challenging. But I think that, you know, communications around this, having conversations early, being prepared, again, which is why we're at the table here to have difficult discussions to figure out, you know, where our gaps are, figure out where communications can be, you know, improved, can be more efficient and more effective.
It's David Reeves. The increase in the number of FAD investigations, how much of that would be, that increase would be associated with Seneca Valley virus?
Fair number. I can't give you a specific percentage, but I know the vesicular lesions associated with Seneca Valley virus have.
That was one question I had. The second one was, would one of the labs, would there be a trigger that they would, something in the clinical description that would cause them to test for JEV?
That's a really good question, and I'm not sure that we've talked specifically about triggers and actionable items. And again, that's why we're here to gather the information about, you know, where should we set our triggers, and, you know, what is the industry norm for this specific region. You know, to be able to take that and communicate back with our null network. You know, again, we can't create triggers in a vacuum. We need to be able to sit down with, you know, the swine industry, sit down with the states, and sit down with the null labs to figure out exactly what's reasonable, what's capable, what we're capable of doing.
And my third question is can you detect the virus in mummified fetuses?
That's a great question, and I do not have the answer to that. I'll have to get back with you on that one.
Okay.
Are there other questions? Eric, is anybody online? Does anybody on the line have questions? Okay, all right. Mike, thank you.